I'm Patrice, as most of you know. I'm going to show you how to do the CCHD screens that we're going to be taking over September 15th. We used to do them and then they got taken away during COVID, and now we are back in action. So a little bit of background on the CCHD. Obviously it is to identify congenital heart disease. There are a list of different things it specifies, but it is done at the age of 24 hours, not before, and as close to 24 hours as possible. 24 hours of delivery. A pass is obviously a normal saturation, and a fail is an abnormal saturation. So we do preductal and postductal. The preductal sites, the preferred site is the right hand, and postductal is either foot. It actually could be either foot. An automatic fail is any saturation that measures below 90%, whether it be on the hand or the foot at any time. If you get a fail that is below 90%, then you need to let the nurse know or the doctor know immediately, and they carry on with the next steps in the care of the baby. Acceptable passing is a difference of no more than 2. So preductal 98, postductal 96 is a pass. Preductal 98, postductal 95 is a fail. Should you have a fail, as long as the saturation is above 90%, you wait an hour, and the baby actually has to fail the test 3 times before it's reported to the nurse and further things have happened. That's if the saturation is above 90%. If it's below 90% at any time, you do not do it 3 times. The first time it's below 90%, it's a fail, and you inform the nurse, like I mentioned, and then they inform the doctor. So now I'm gonna let you see all the supplies we have to collect. So usually we encourage everything, all the testing to happen in the room with mom. For the sake of this, I have our little baby here, and obviously we're in the nursery. This equipment that you need are 2 pulse oxes. These are found generally in the nursery. They're usually right here in the nursery, or sometimes they're in where the Omnicell is. If you ever have any questions, all of the nurses here know where they're located. They can absolutely help you. And then you also need 2 of the actual pulse oxes. They are the baby ones, they're not the adult ones. And then you also need a posy. Posies aren't mandatory, but they absolutely help a lot in getting a clear reading and expediting the whole procedure. As you know, babies are not going to be like this. They're going to be moving and crying and doing all the things. So you can place the pulse ox on the baby's hand or on the baby's wrist, whichever works better for you. And then obviously the posy goes on afterwards. And then, as I mentioned, either it can be either foot postductally. As long as you have a good waveform, a 30-second to 1 minute saturation is appropriate for recording. And sometimes, depending, you might have a fussy baby. A trick that I do personally sometimes is I hook the babies up with the pulse oxes. I plug them in, and then I swaddle them or kind of keep them tight, because babies are consoled that way. I personally have even, if the mom's comfortable, done it while mom's breastfeeding. I know not everyone is comfortable with that, but you definitely want, for the best, easiest results, you want a happy baby. They also have these little sugar squirters. Sometimes if you could put a glove on and put some on your finger and put your finger in the baby's mouth, it appeases them. They suckle a little long enough for you to get the saturation that you need. Attached after this, or another attachment, I guess, Dan did some clips on how the appropriate way is to chart this, to chart everything. So there's also a little cheat sheet in the department on the charting, the different steps. So obviously if you have any questions, you can always go to your lead or go to Kelly, but that sums it up.